Fatigue, neuropathy, memory problems, these are all common issues with B12. Brain fog is another one. So in this video, we're going to do a deep dive on B12. Now we've got the short explanation in my short section, but we're going to do a deep dive on B12 here. What is B12? Why do we need it? What are the risk factors for low B12? What's the problems that we have from B12? What symptoms can we get? How do we test it and how do we treat it? So let's get started. B12. It is important. In fact, some might say it is essential. B12 is an essential vitamin. You can only get it from your diet. And that is a challenge for a lot of people. It is easy to get from sources like meat and dairy and poultry, but very hard to get it from plants. In fact, there's a few only plants that you can get B12 from, such in that family, in the plant-based family, such as soy, almonds, some yeasts have it, mushrooms can have it, so things like tofu and tempeh you can get it from, but that amount in the B12 is lower in those things than in the animal-based category. So it poses a challenge from people. So risk factors for it, if we roll straight into that, being a vegan or being a vegetarian or plant-based puts you at increased risk for a B12 deficiency. Now, those can be very healthy diet plans for people, and I have a lot of my own patients who thrive on those diets, but it's important that we test the B12 levels, and likely you will need to supplement for the reasons I just mentioned. There are a number of other reasons why you might be deficient in B12. So it can be an absorption issue with B12. So people with chronic acid reflux, taking acid reflux medicines like Tums or Pepcid, for example, or especially the proton pump inhibitors like omeprazole, Nexium, these make you produce less acid in your stomach, and it makes it harder to absorb the B12. So on that line too, we have people who have chronic GI issues. Sometimes people, for example, with chronic gastritis, if you have a history of, let's say, ulcerative colitis or Crohn's disease, those can be a problem. Not only for that, but for the people who elect to do things for themselves, such as get a gastric bypass surgery or a gastric sleeve. You will absorb less B12 as a result. So we have to be mindful of that. Some other issues that we have, some medications can affect how B12 is absorbed. Now, lots and lots of people are on GLP-1s now, like Ozempic and Wegovy and Zepbound and Mounjaro. And those products were initially made for diabetics, but we found out that there's a lot of other good uses for those products, like, for example, for sleep apnea. We're even finding some data that shows it helps with kidney diseases too, certainly to treat obesity and to help maintain weight. Now, I caution my patients when they elect to go on those medications, because you will have lack of absorption of some nutrients, including B12 is one of those things. Because when you take those, what does it do? Well, it slows down digestion, basically, is one thing, and you are less hungry. Less hungry, you eat less. You eat smaller portions, you tend to absorb less. So on one hand, while they're helping you lose weight, on the other hand, you can have a problem with absorbing these things as well. So that can be a challenge. Now, there are some other medications that fall into this category too, even other diabetic medications like metformin, for example. So those are some of the reasons why you might see risk factors for B12. So what are the problems that happens when you're low on B12? Again, think of the word essential. B12 is essential because we cannot make it in our body. We have to intake it in our food. So when you think of other things that are essential in the processes of the body, something like DNA synthesis, I'd call that pretty essential. B12 is critical for DNA synthesis. B12 is important for hematopoiesis, which is the way we make blood in our body. So white blood cells, red blood cells, platelets, all these things rely on B12 to some degree. Okay, we also have things like problems with bone marrow production when we're low on B12. So this can be a tricky thing. Now, if we're prolonged deficient in these things, we can see a lot of other problems as a result of the things I just mentioned. So we can see neurologic problems and we can see hematologic problems as a result of that. So let's talk about some symptoms of B12. Okay, well, symptoms of B12, if we start with the neurologic symptoms first, we're going to get into things like memory issues, cognition issues, brain fog. Okay, so anytime if you were to go to a neurologist with any of these symptoms, I guarantee you tops of the list, they're going to check for B12 deficiency because it's low-hanging fruit and it's easy enough for us to fix that problem. So those are some things. Now, when we have other neurologic issues, you can have neuropathy. That is the sensation of like when your leg falls asleep, for example, when you have tingling and numbness. B12 is directly associated with those things. And I'm going to speak on a personal note for myself. I increased my own B12 and it helped with my neuropathy. Now, if you follow my other videos, I've had a lot of orthopedic surgeries. I used to compete in strongman and powerlifting and things. So I've injured myself a lot. And as a result of the surgeries, I found that I had neuropathy. Now, when I started supplementing with B12 and got my levels up to around 1500, that neuropathy nearly vanished. So there are a lot of benefits to taking B12 carefully. So some of the other things that we think of with B12 when we look at other symptoms, fatigue is a colossal symptom that we see in B12 patients. In fact, it's one of the primary things that I see, particularly in my senior population with people. So I have a lot of seniors who are on regular B12 injections because they're just not absorbing in their diet, because they're not eating a high protein diet. The other things we see is, to do with cognition. We can also see depression on the rise as a result of problems with B12. So we have to be mindful of those things. Some other obvious signs of B12 deficiency, well, you can have pale skin because of the difficulty with hematopoiesis, making the red blood cells, okay? We can also see glossitis, which is a swelling of the tongue. That's common in pernicious anemia, which is a long-term issue with B12. We can also see, if you've ever seen people with angling cheilitis, that's the cracks in the corner of your lips, that can sometimes be associated with B12. So really important with B12 too, symptoms, pregnant women. We always want pregnant women to take B12 and folate because it is essential for neurotube development and the health of babies as they're growing. So one interesting fact is that the mother will not send the B12 on to the baby, particularly when they're breastfeeding, unless they have enough themselves, because they're unable to do that. And remember, again, it is essential. So when we look at how do we test for B12 deficiency first before we talk about fixing it? Well, there's a lot of tests that we do for B12 deficiency. No, your doctor is going to order a complete blood count, a CBC. And one of the things that I look for in a complete blood count is anemia, right? So if your red count is low, your red blood cells, hemoglobin, hematocrit are low, we look for the reasons that's why. So when we break down the red blood count further, we can look at the size and shape of your red blood cells. And there's something called macrocytosis. And that is when your MCV, mean corpuscle volume, so that is kind of like a BMI of your height to weight ratio of your red blood cells, right? If they're large, we do think of things like B12 and folate deficiency versus like if they were small, we might think of iron deficiency. So that's one clue that we might, hey, let's order a B12 on this person. So especially if they're symptomatic, if somebody comes in, they tell me they're fatigued and I see that they're anemic and they've got red blood cells, we're ordering a B12 for sure. So when we get the results back of that, we may order a cascading effect of things. So for certainly, we're going to order a B12. Now, the B12 level, it's a very large scale, and important with any lab that you get is it depends on lab to lab. So if you get like the nationwide chains like Quest or LabCorp, things like that, or particularly the labs that I use, they will all have a little bit different reference ranges, okay? But in the greater scale of B12, the scale typically runs from 200 up to 2000 is the readable range. So that is a 10 times scale. There's a lot of wiggle room within that scale for people. Now, you are clinically deficient if you're less than, let's say, 200 to 250, depending on many labs. For the most part, I see people that are in the 300s and even less than 400 that tend to be symptomatic. It's a more common thing. Now, you can be symptomatic in the 400s, 500s, 600s. And as I said, for myself, when I started seeing relief of my own personal symptoms, that was in the range of like 14, 15, 1600 in B12. I don't want to go too crazy high above 2000 because then I can't rate it. And then I look, well, my 2001 or my 10,000. I don't know. Because you can have this sort of paradoxical effect with B12 when you get too much. And there's almost it's very rare. But I've had patients that are just kind of overboard with B12 and they almost develop like a toxicity, which is the same type of symptoms that they see, neurologic issues when it's super low. So order the B12. Some other tests we might consider ordering, you've probably seen these online. Methylmalonic acid, MMA, is one of them. Homocysteine is another one that kind of helps refine, is this truly a B12 deficiency or not? Okay, so we've ordered the test. Now we've decided, hey, you're deficient in B12. What do we do next? Well, we kind of look at the severity of it. First of all, are you symptomatic or not? Okay, if you're symptomatic, we get a little bit more aggressive with treatment than if you're asymptomatic, even if the numbers are the same. And interestingly, I'll see people come in. I may have two people that have the exact same level of B12 when we check it. One of them's totally fine. The other one is fatigued and experiencing all these other symptoms and neurologic issues and other problems. So in that case, it would be a little bit more aggressive. Now, one thing that I failed to mention earlier, and this is really important, patients who've previously had cancer and received chemotherapy and radiation oftentimes will develop this neuropathy. So what we do usually is augment their B12 during therapy to kind of help prevent these symptoms from occurring. So you're deficient in B12, what are we going to do about it? Well, you've got three main categories of choices. Choice number one is oral therapy. Now, that is very poorly bioabsorbed. And if we go back and look at those people when we were talking about with the absorption issue or on medications like Ozempic, for example, you're really not going to absorb that B12 very well. So that's when you look on the B12. And our goal, the recommended daily allowance, I think is something like 2.4 micrograms per day. But when we look at our goals for people, and then you see the medications, when you pick up that jar of vitamins, it says B12, 50,000% of the recommended daily allowance, seems like an absurd number, but we really do not absorb much B12. So there's a couple ways to get it in the pill or gummy form, which is cyanocobalamin, methylcobalamin, and then there's hydroxycobalamin. Now, the three of them, statistically, they're all about the same, to be quite honest with you, in terms of what absorbs better. Now, you'll see some people claim one is a little bit better than others, and some are a little bit more long-acting than others. Just anecdotally in my clinic, I haven't seen much difference between patients. I think it's more of an absorption issue and a volume issue of how much you take. So that's one way to take it, and that's the most kind of simple way to take it. The next step is sublingual. Now, the sublingual bumps it up into the next category. Those are the drops that you're going to take under the tongue. Sublingual is more effective than taking the gummies, okay? Some people don't like the taste of it. Sometimes it makes your pee red or orange too when you take it, so that's kind of a weird side effect of it, but it is a bit more effective in that sense. Now, the final way that we would give B12 is shots. So I have patients that get B12 anywhere from once a year to once a week, quite honestly. And it depends on how well you absorb it and how well you keep it. So B12 is interesting because it's stored in the liver. And when the liver has enough, then we'll see it spill over into the serum, which is your blood that we detected in. So I'll get primarily the people that I see that are on the B12 that more frequently tend to be senior citizens. Those are the ones. They're not absorbing things very well. They're not eating a high protein diet. So they tend to benefit the most from that. But I do have a lot of other patients that are on B12 shots as well. People with depression, it seems to anecdotally help a lot of them. Certainly the fatigue issue. So when I target B12 with patients, it's really an individualized response that I look for. I find most people benefit once they hit about 1,000, give or take, and I try and really never go over 2,000 just because we can't test it at that point. So if we're pushing the envelope with that, I usually say, let's stretch out the shots. Typically, we'll do a course of B12, usually about over 8 weeks, 2 to 3 months, somewhere in that range. And then we'll recheck it and see your response to it at that point in time. And we'll see if we see the B12 responding well. And then if we see the anemia resolving, we know we're doing something, and especially if your symptoms resolve. So that's pretty much the ins and outs of B12. It is essential to repeat that for people now, but it's not everybody that needs it. But I do find that a lot of people find good benefit from taking B12. So I hope this was helpful. This was your little bit of info on B12. If you want the abbreviated version, you can always see the shorts. Like and subscribe. I have a lot more comment and content for you. All right, take care. Dr. John Schmidt, always on call.